May is Mental Health Awareness Month, and the VA is asking veterans to prioritize their mental health right now. Florida has the third largest veteran population in the nation. But how are veterans doing with the pandemic, especially if they struggle with PTSD? As we look forward to a rebound, we're helping veterans find the resources to handle what's happening now and what comes next.
And essentially, we're providing the same level of care, just virtually now.
Dr. Ronald Gironda, chief of psychology at James A. Haley VA Medical Center, says medical assistance right now is critically important for veterans, especially those with post-traumatic stress disorder.
Not only have our anxieties been heightened, but our normal routines have been disrupted in an unprecedented way. And of course, veterans with PTSD and other mental health conditions are at increased risk for worsening of their symptoms.
The contributing factors include social distancing measures, financial stress, and more.
For many, it's a disruption in normal patterns, such as eating patterns, sleeping patterns, physical activity. And then, of course, there's increased consumption of alcohol and other substances.
And there are warning signs a veteran may need help, especially if you see changes in how they're functioning or their mood.
It could be increased negative emotions, such as sadness or anger or fear. It could be changes in behavior, such as increased crying, irritability, angry outbursts, or social isolation. That's a big one.
And Gironda warns, pay attention if a veteran threatens to harm himself or becomes preoccupied with death.
We also look for things like that we call preparatory or closure behaviors, things like giving away possessions, prized possessions, or creating a will.
But mental health services are available through the VA, and many are free. They include telephone or video appointments, online chatting and texting, the VA's National Center for PTSD, and VA's mental health apps. And for any veteran still struggling right now, Gironda says, pick up the phone.
Well, I would just encourage folks to reach out if they need us. We're here for you.
And here's the Rebound Rundown. If you're a veteran who needs help, call the Veterans Crisis Hotline. It's answered 24/7. You can also visit maketheconnection.net, a website with more about mental health resources, or sign up for text message reminders that help veterans monitor their symptoms. Finally, the National Center for PTSD just developed a free app called COVID Coach. It helps people manage stress and offers resources for dealing with isolation, anxiety, and unemployment. We've put a link to these resources on our website at abcactionnews.com/rebound. Paul?